Today we're going to be reviewing the role of the nurse aide. This will be part of your written test for your CNA for the state of Florida. The first section of the written test is about 20%, and today we're going to be covering all of this under A here, so personal responsibilities of the nurse aide. So let's get started. The personal responsibility, basically, if you are committed and caring, you're going to be just fine as a CNA. Your main role is to promote health, prevent harm, and prevent infection. If everything in your practice is about promoting health, preventing your resident from being harmed, and preventing infection, you will do just fine as a CNA. Some important things to remember are to always maintain a clean and safe environment. Look around your environment before you leave the room. Is it safe? I can't tell you how many times I come into a room and a CNA has forgotten to move the overbed table out of the way. That's a fall hazard. So always just take that last second and look around and make sure that the environment is safe and there is no fall hazards in the room. Know what your role is as a CNA. Respect the confidentiality of your patients. Follow the directions that were given to you. Be honest. Show respect. Be sensitive to individuals' beliefs. Be a good listener. Be considerate and encouraging. So these are the requirements, the reporting requirements by the state of Florida, and I just broke those down for you. So when the reporting requirements are, once you get your CNA license, if you move, you have to notify the board within 30 days that you moved. You must report to the board any person that has a license that is in violation of any rule of the Board of Nursing. So if you work with another CNA and you know that they've committed a crime, but they didn't report it to the board, you have to report it to the board. And if it can be proven that you didn't, you can lose your license along with that person. If you've been found guilty or entered a plea of no contest to a crime anywhere in the world, you have to report that to the Board of Nursing in writing within 30 days. So the next section is about the promotion of health and safety. The most important thing is that if you're in good health and you're well rested, you are going to make a lot less errors as a CNA. So it's important to always eat a well-balanced diet, drink plenty of water, get at least 8 hours of sleep and regular exercise. The better health that we are in, the better we'll be able to care for our patients. If we want to provide good care for our patients, we must first provide good care to ourselves. Now, this is about the next section, promotion and protection of residents' rights. So every resident has these rights. If you feel that any resident have these rights being violated, it is important to speak to your supervisor, or if it's your supervisor that's violating these rights, then it's going to be your supervisor's supervisor who you would report this to. But you must report it and you must document that you did report it. If you don't document that you reported it, then that's the same as not reporting it, and you can get in just as much trouble as the person who was violating those rights. So every resident has these basic rights, and the basic right is to be treated with respect. If you treat your patients with dignity and respect, you are going to have a fine career as a CNA. It is the cornerstone of all care that we give. Your resident has the right to decide when they want to go to bed and when they want to get up. They are not in prison. They are in a hospital or a nursing home or a long-term care facilities. They have the right to choose when they're going to eat their meals. So do not treat them as if they are in prison. Treat them as if they are a patient and you have been assigned to care for them. Participate in activities. Your residents have the right to participate and to be stimulated. No one likes to have nothing to do all day. We all like to be challenged physically and mentally, and to the level that we're able. And so your resident has that right, and you need to protect and promote that right. Be free from discrimination. You cannot discriminate against somebody because of their race, color, national origin, disability, age, or religion. That is against the law, and you could lose your license. You should never neglect or abuse your patient. And so your patients have a right to be free from verbal, sexual, physical, or mental abuse. If you treat or you see any kind of abuse, you have to report it. If it is not reported within 5 days, you could lose your license. So make sure if you see some abuse that you document it and report it. Treat and expect all nursing home residents to be treated like you would want your favorite aunt or grandma to be treated, and you will be A-okay. Free from restraints. We cannot restrain residents for a discipline. I will never forget one time in this one nursing home, this one resident liked to set off the fire alarm. No matter how tempting it might be to restrain that patient, that resident, so they can't set off that fire alarm, that is illegal. We cannot do that. That's false imprisonment. You can't give them medications to restrain them. Closing a door to leave a resident in their room is against the law and a form of restraint. You can't say things like, well, you just need some time to go in your room and think about it. They're not a child. They are not to be restrained. You must use your creative problem solving if you run into an issue like the resident that liked to set off the fire alarm. What we did is we had a sitter then watch that resident and keep that resident engaged. And what we found out was that resident was just bored, and once we had somebody engaging them with, they love to do puzzles, then we no longer had the issue of the fire alarm. But it would have been against the law to restrain that resident so they couldn't set off the fire alarm. Make complaints. Your residents have the right to make a complaint without fear of punishment. Get proper medical care. All of your residents have the right to get proper medical care and to be informed about their medical care. Your job as a CNA is not to answer the questions about their health status, but to direct their questions to the nurse and then follow up and make sure that they are answered. They have the right to have their representative notified. So the resident, the nursing home must notify the resident's doctor and any legal representative if there was an accident, if there's any physical changes, mental or psychosocial, or if the nursing home decides to transfer the resident. As a CNA, you're not responsible reporting these changes to the doctor, but you should notify your supervisor and then document any care that happens. If an accident happens, just be honest and promptly report it. A few years ago, I had a student in the nursing home, and this student was our very first day of clinicals, and in making the bed, the elderly skin is very thin and frail, and she actually tore some of the skin of a resident and it started to bleed. Instead of reporting it, what she did is she went to the nurse and asked her for a Band-Aid. The nurse, being very, very clever, very smart, said to her, "Why do you need a Band-Aid?" And she said, "Oh, it's just I just need it for me because I cut myself last night at home." Well, the nurse didn't buy it and actually spied on and followed the CNA student and found out the real reason. And that CNA student was then dismissed from the nursing home. accidents happen, things happen. Just be honest about it. The last thing we would want is a family member to come to the nursing home, that resident to have an injury, and us not to know about it. So if something were to happen, just make sure that you are honest and prompt in reporting it. Your resident also has the right to get information on fees and services and manage their own money. It is important that you understand these rights, so as a CNA, if you see these are violated, you can report it. Your resident also has the right to proper privacy, property, and living arrangements. If spouses live in a nursing home, they can live together. They get to keep their personal belongings. They have the right to private visits. So if they have someone over visiting, they can shut the door and ask not to be disturbed. The nursing home is their home. And just like you would like privacy, they also like privacy. They can get phone calls and have emails. And they have the right to have their property protected from theft. They have the right to spend time with visitors. And they get to have visitors when they want to have them, as long as it doesn't interfere with other patients. But they have the right to spend time with those private visitors and to see them as long as they want. Now, if they have a roommate, they can't have somebody come over at 2 o'clock in the morning and wake everybody up, because that's inconsiderate. But I had this one patient one time, their nephew worked third shift, and he got done about 3 o'clock in the morning. So about 4 a.m., the resident was up anyways. He would like to stop by and visit with his grandmother. And we did have a special place for them to visit that was not interfering with the other residents' sleep. So they do have that right. They have the right to get social services to help solving problems with other residents, in discharge planning, any counseling, any kind of social services that they might need. They have the right, and nursing homes must provide this for them. They have the right to leave the nursing home to go home for weekend visits or things like that with family members. It's important, though, to understand sometimes a patient might want to go, but the family is advising against it, and it might have to do with insurance coverage. Certain insurances, if they leave the nursing home, especially if they're there for rehabilitation purposes, the insurance will stop paying. So there might be some kind of insurance issue, but even if they agree that they understand that insurance is going to lap and not pay for it, and they'll pay, pay for it on their own, they are more than welcome to leave. Okay, this is not prison. Again, this is their home. They have the right to have protection against unfair transfer or discharge. Just because there's a personality conflict doesn't mean that the nursing home can discharge them or transfer them to another nursing home. There are some incidents, however, where the resident can be transferred or discharged if it's for the safety of others. If they're having an issue where they could be infectious, they could be combative, where they're actually harming another resident. So we just need to find a better place for them. If their health is improved to the point where they no longer need the services of the nursing home. If the nursing home hasn't been paid for services, or if the nursing home closes. They have the right to participate and form groups. So if they want to form a group about better CNA care, they get to do that. And when the group forms and they come up with ideas for better CNA care, the nursing home must abide by and must listen and act upon their grievances. They have the right to have their family and friends involved in their care. Now, the next section talks about time management and work prioritization. So this is what it's important to understand about this topic, is once you've been assigned residence and you get your daily assignment for the day, the first thing that you must do is you must make a quick visit to every patient to see if there's any emergency needs that need to be attended to. As you visit each resident, you're going to write down anything that needs to be done into 3 categories. Is it critical, significant, or nice? Anything critical needs to be attended to ASAP. And I think we'll talk about that, critical, significant, and nice, in the next slide. So here's some examples. You've been assigned to take care of 6 residents. Step 1, visit each resident to see if they have any critical needs. Take care of those needs immediately. Let's say you go into room 414 and Miss Jones has just woken up and needs to use the restroom. Well, in the morning, we all need to go when we need to go, so that would be a critical need. You wouldn't move on to the next room until you took care of Miss Jones and got her to the restroom. Then step 2 is after you've looked at that, you're going to check the schedule for the day, and you're going to see that Mr. Smith in room 412 has physical therapy in 30 minutes. That's significant. He needs to have all of his morning care done so that he is ready to go when physical therapy comes to get him. Then step 3 would be Miss Cannon in room 410 loves to put puzzles together. So maybe that would fall under that nice category. You would go to the recreation director and see if you can find a new puzzle for Miss Cannon, or ask one be ordered for the unit. So those are some examples of critical, significant, and nice needs. Being a CNA is one of the most labor-intensive jobs in healthcare. The only way to have a successful day is good planning. If you can't meet all the needs of all the residents, then you have to make a plan. You can't just leave it undone. And you must document how you are going to address that plan. An example is that you notice you have 1 hour left in your shift, but 5 patients have still not received oral care, and 4 patients have not been ambulated because of a medical emergency with another patient that took most of your morning. You cannot just leave that undone. You have to make plans with the RN to complete all the care. That may mean that you ask another CNA to help out. Oral care and ambulation are important parts of care, and not performing those are neglect. So those must get done. If you are not able to, you must document how you are planning to get those done. And a lot of times it means calling in the help of others. All right, the next section of the written exam that we're going to cover talks about work standards, including ethical and unethical behaviors. The work standard behaviors, CNAs should look professional. We need to have clean uniforms. Your uniform should be washed and laundered every time. You should never wear a dirty uniform to work. Personal hygiene. You must shower before each shift. A daily hygiene, attending to your oral and your hygiene needs, is very important. You do not want to bring germs or pathogens into the nursing home, and you must not bring in any kind of body odors or bad breath to our residents. Your hair needs to be pulled back or styled so it's off the shoulders and off the face. Artificial nails and colors, that is not okay. Artificial nails actually harbor a lot of pathogens. About 5 or 6 years ago, there was a hospital and a couple of NICU babies had died from staph infections, and they couldn't figure out the source of the staph infections, and it all came back to the RNs wearing artificial nails. Your artificial nails could cost somebody their lives. Please do not color your nails with nail polish or wear artificial nails to work. It is important that you report to work on time. In healthcare, everybody relies on everybody else, and you have to report for your assigned shift and on time. If for some reason you get sick, you need to notify as soon as possible, not after your shift starts, but as soon as you possibly can, so plans can be made to take care and cover your shift. The guiding ethic principles: protect your patient, respect the role that you play in healthcare, and treat all patients equally. You do this and you will have a long life in healthcare. Unethical behaviors: stealing from your patients or your employers, checking your phone for social media accounts when you are not officially on break is a form of theft. If you don't attend to a patient's need promptly, if they push the call light, that is neglect and that is unethical. You cannot accept money or gifts from a patient, so stay away from that. Many times in healthcare, the family members, especially around the holidays, like to reward us with gifts or money. Please respectfully decline these. And there's always a couple questions on the state board about that. That is unethical and you should never do that. So the last thing that we're going to cover is about the nurse aide registry. In the state of Florida, you have to be listed on the state registry. It is a crime to work as a CNA without being listed. How do you get on the state registry? Well, you're going in that direction right now is you'll pass the test, both the written and the clinical skills part of the test. Once you do those, you will be listed on the nurse aide registry. If you are licensed by another state and you're here in Florida, it's going to work a little bit different for you. So I've provided a link there for you to look at should you need it if you are applying to work as a nurse aide and you are licensed in another state. All right, so if we look back through all of this, I think we've covered pretty much everything right here that's on the state test. The reporting requirements, the promotion of personal health and safety, protecting residents' rights, time management, workplace standards in the nurse registry. The next video, we're going to cover B, so stay tuned.